Hey guys, so today we're going to talk about this patient that came in. He was unable to sort of speak very well, and he had a major issue that took place with the this inability to speak, and he could repeat though. You could tell him something, and he'll repeat what you say, but he couldn't speak. And the best way that I actually remember patients with this kind of a case is by this scene that I remember in this movie, Liar Liar. And just take a look. Although it's not a funny situation, patients with stroke can be in this situation. It's not funny, but it can help you remember, because this is, if you're experiencing symptoms like this, I mean, obviously you're not you're not imitating Jim Carrey, but this is basically it, where he can't speak. Notice he just cannot speak, cannot speak, cannot speak. This is, of course, very exaggerated, but that's basically it, where he can't speak. Right. So it's very interesting. So it's really interesting as far as um, the inability to speak and whatnot, and then he's able to repeat. Notice? So it's really, obviously Jim Carrey did a phenomenal job of giving you an example and us an example of what transcortical motor aphasia actually looks like. So it's pretty cool that there's actually a movie clip like of this, and it's actually entertaining to watch in the situation, but it can sort of be burned in one's mind that, if the inability to speak is there, you should take somebody to the hospital immediately. And since in India, National Stroke Day is coming on October 29th, this is sort of a good thing to be able to talk about, in my opinion. So the next thing that I wanted to talk about is actually, where is this lesion and where in the brain does this take place? Does it take place on the left, on the right? Well, usually this takes place on the left. And the reason is because most people are right-handed, but that's not the reason. That's just the association that takes place, and that's the phenomenon, is that usually with this left-sided inferior division M2 occlusion, you get that sort of syndrome. And now we know that in stroke, when people are actually having these symptoms, they can go in that far to the M2. So M1 means closer, M2 means farther away, and M2 for inferior division is something that they can actually go after now, and they can recanalize if the TPA or alteplase that we usually use doesn't work. So especially in India, we have, at this point in India, we have 70,000 hospitals that are out there, and TPA should be standard of care. We have 1.8 million people that don't have, all of them don't have access to TPA. In fact, a small percentage of them do. So just remember, as far as, they say time is brain, and this is why, is because there's only 4.5 hours where right now we can give the medication. Of course, there'll be, later on, there will be an extension of this time frame, but usually that's only the time frame that we can actually give this medication. And so it's a super good video to remember, this Jim Carrey video, and it's also something that you want to remember in case you see somebody with symptoms like this. It's not a joke. Get them to the hospital, get them their alteplase, their TPA, in case there's no bleed in the brain, and make sure that you consult a professional neurologist that's actually looking after the case. All right.